I heard you've been thinking about plastic surgery, and guess what? So have I. So let's get into it. In the meantime, we're going to be talking about everything from pre-op to post-op care. I got you, girls. So go ahead and follow me and save this video so you can get all the tea that I have learned myself from doing my plastic surgery research over the past, I want to say like a year and a half. So today we're going to be getting into part 1 of pre-op care. This one's going to be about vitamins and supplements. So a lot of the vitamins that I'm about to list off for you guys, they can be found in just a prenatal. But I'm going to give you guys a disclaimer. If you do choose to take prenatals, which I am, and I've been taking them, it's good to stop taking them 1 to 2 weeks before surgery. And the reason being is because prenatals do have vitamin E. And if you research vitamin E, it's actually a blood thinner and it can increase bruising also. So that's something that you're not going to want if you're obviously having an SX. So I do recommend, if you choose to do a prenatal so you don't have to stack so many vitamins and take multiple pills, just stop 1 to 2 weeks before surgery taking the prenatal and then switch to taking a stack of vitamins. I also forgot to mention that if you take vitamin E, you will also bleed more. So don't do that. Okay, so the first vitamin we're going to talk about is vitamin C. And the reason why you should take vitamin C is because it's going to boost your collagen production, which is super important before surgery. Vitamin C is going to boost your immune system, and it's also going to help you with your wound healing. You should be taking 500 to 1,000 milligrams a day. Iron. Okay, this is super important, especially if you're normally an anemic or low iron girly. You definitely want to get that iron up. If you know, you know. A lot of doctors will cancel you if your hemoglobin is not high enough. So you need to take iron to make sure you're in the proper levels. Of course, you want to make sure you're testing yourself before you get there to make sure you're in the proper levels. But not everyone does that. And some girls literally have to struggle last minute taking supplements and doing this, that, and the other thing to try to make sure they can get their hemo up. So make sure you're on top of your iron intake. Also be careful not to overdose yourself on iron, because that's not good either. So also be careful with that. So what iron is going to do is it's going to replace the red blood count cells that you have that are lost during surgery, and it's also going to prevent anemia. This is going to keep your energy levels up, and it's also going to prevent dizziness and fatigue that you might encounter from having blood loss. You can do about 65 to 100 milligrams a day of iron, but there's different ways to get iron. Of course, you can do pill form, there's also liquid form, and there's also ways of cooking to get iron, like cooking on a cast iron skillet or buying an iron fish and adding that to your pot or whatever you're cooking when you're cooking. You could also just up your vegetable intake, because that's also going to help you obviously with all your vitamins. But some vegetables that you can get iron from are spinach, kale, collard greens, beet greens, broccoli, peas, and then there's also lentils, pumpkin, sesame, and the sunflower seeds will also get you iron. I don't want this video to be too long, so follow me for part 2. Next one we're going to be talking about is folic acid. This is going to aid your body with red blood cell count and cell regeneration. This will aid you in healing and tissue repair. You're going to want about 400 to 800 micrograms daily. Next thing on the list is going to be vitamin A. This is going to support your immune health and your skin and mucous membranes. This is going to help your incisions to heal, and it's also going to prevent you from getting infections. You can have up to 10,000 IUs of vitamin A day, but only short term. You don't want to have like 10,000 IUs for like a long term, because it can become toxic to your body. Zinc. Zinc is really crucial for immune support and also healing of your incisions. taking this is going to reduce your chance of getting infection, and it's also going to speed up the recovery of your incision sites. So it's super important to take zinc. So you can take 15 to 30 milligrams a day of zinc, but you don't want to take too much because any more will interfere with your copper absorption. B complex vitamins, especially B6 and B12. This is going to be a huge deal for your energy, your red blood cell formation, and also your nerve function. Bromelain and arnica. You're going to want to start taking these about 2 weeks before your surgery. This is going to make your post-op swelling, bruising, and pain way more manageable, so it's definitely something you don't want to skip. And just so you know, one natural way to get bromelain in your system is from eating pineapples. This last one I'm going to list for you is actually optional, but this one is magnesium. And this one is going to help with muscle relaxation, sleep, and constipation, which is a common symptom after anesthesia. Also, a side note about magnesium, even if you're not thinking about surgery or whatever, or just after surgery, if you're an over-emotional girly or you just constantly having mood swings and stuff like that, magnesium can really help mellow you out. If you're not an over-emotional person, you gotta be careful because it could actually make you like emotionless. So, something to think about. So follow me because next time we're gonna be talking about what supplements not to take before surgery.